Hello, and welcome to the HSJ Health Check podcast, where each week we explain and debate the most important news issues right now in NHS policy and leadership. I'm Annabelle Collins, and this week I'm joined by Bureau Chiefs Lawrence Dunhill and James Illman, and Senior Correspondent Rebecca Thomas. After a week of readjusting to our new way of working, we are back recording remotely and will attempt to break down the key news stories this week. Needless to say, our coverage is now completely focused on bringing you the very latest on what the NHS is doing to deal with and prepare for the coronavirus crisis. Last week, when we last spoke to you, it was very much in the planning stages, but early this week, things took a real turn, and arguably a turning point was the news surrounding Northwick Park. And turning to Lawrence, who covered this story, would you be able to give us an overview of what happened and how significant this was?
Yeah, hi Annabelle. I think last week and in the previous weeks, London and the rest of the NHS has kind of been very much in planning and preparation mode, and lots of kind of guidance was issued by NHS England and improvement around what should happen when the surge of cases comes. And to some extent, a lot of people were probably still in denial about how big and serious this was all going to be. Then on Friday, Thursday night, we found out about it on Friday. Northwick Park declared a critical incident, effectively saying they'd run out of beds and they would need help from other hospitals to transfer patients to. And I think that surprised quite a few people in the London system, and certainly the public as well, once that news got out and the kind of urgency of the situation really hit home. And since then, it does appear that the kind of efforts to increase capacity, critical care capacity in London have really ramped up. And we've seen some eye-watering numbers this week of the number of surge beds that trusts expect to be able to open at trusts like Kingston, Croydon and Barts especially. Then yesterday, of course, Matt Hancock also announced the plans to open a huge field hospital at the Excel Centre in the Docklands, which they think can have 4,000 beds. And then I suppose a key part of this also is a deal has been struck with the unions to relax the normal staffing ratios for critical care. Normally you'd have one specialist nurse per patient, and they've relaxed that to 6 with that specialist nurse supported by a team of non-specialists instead. And then for intensivist consultants who would normally look after between 8 and 15 patients, that moving out to 1 to 30. And again supported by some non-specialists, and that sort of relaxation of the normal staffing levels should enable, will hopefully enable them to staff all these extra beds and wards that are going to be created. But I think still, despite all this work, there's still a lot of concern about how the numbers are ramping up, and whether London is going to be able to keep up. Rebecca, I think you picked up some intelligence from mental health leaders, didn't you, about something Claire Murdoch has said?
Yeah, I was hearing yesterday. She was quite direct in the concern for the acute services in London, running, if nothing is done, a caveat with if nothing is done, ICU capacity running out within 4 days. And obviously, as Lawrence you've explained, there are things being done, but I think all eyes are focused right now on acute capacity, ICU capacity for London. I was going to ask you, Annabelle, but Lawrence has picked up on the staffing ratios, but obviously they're going to need a lot of other staff in terms of that, and they're calling for volunteers to help staff the Excel Centre. What are we likely to see? How's the training or upskilling likely to play out or look like?
Well, from conversations I had last week, I think the focus is on kind of redeploying staff, and I think that there's like a real kind of concern that this is done So patient safety is maintained and staff safety is maintained. So kind of as Lawrence said, there'll be a specialist critical care nurse supported by other members of staff, and also, as we're seeing now, some volunteers as well. So I was told kind of healthcare assistants would be coming in, and they would be trained to I think the phrase used to me was to be an extra pair of hands. So I think the unions are particularly clear. They don't want to see staff working inappropriately. And although we have seen guidance from the different regulators that they are enabling some staff to work kind of beyond their registration and to kind of stop, they're not going to be, prosecuted for doing that as they normally would be. But I think it's very much about kind of skill mix, and as I think you've heard as well, kind of refresh or kind of upskilling training. But I think I've kind of seen quite a lot of talk about upskilling, and some people, quite wary about using that term because it kind of sounds a bit. It sounds like it's much more simple than it actually is to upskill somebody to work in, to work a ventilator. That's obviously not going to be possible to get a healthcare assistant working a ventilator. It's all about kind of supporting the more specialist staff members.
Lawrence, did you hear much when you broke the news? Did you hear much concern, or did concern about the dilution of the staff ratios, or did people generally welcome it?
Yeah, I was quite surprised by the sort of tone struck by the union leaders I spoke to, actually, because obviously normally agreeing to something like that would be completely unthinkable for their profession, and would cause outright revolt, you would have thought. But both the nursing and the medical union said, yes, this is going to cause a lot of concern, but it's necessary, and it's just what has to be done.
Comes back to that this clinicians having to make difficult choices, that it keeps coming up, that phrase, I feel, in my
Yes, yeah.
And it definitely feels like I'm speaking to a few people about guidance coming out last week around speeding up discharges, and again, there were some things that are being done there, like the suspending of continuing care assessments, where I thought certain sectors, certain parts of the sector would not be happy about that, but there's definitely we need to just done. I think someone said last week that corners would inevitably be cut, and we're going to have to hold our nose for some of this, but we just need to get on with it. And yeah, it's surprising, but it's just where we're at to.
Yeah, it feels like it's just not the time to be worrying about that stuff.
No.
But I sort of wonder about what's going on in terms of kind of community care and social care, or everybody being discharged from acute hospitals, kind of just the amount of work that's going in to make sure they have somewhere to go, and if they're still needing to receive treatment, where are they receiving it?
Yeah,
that was another story we ran last week, wasn't it? There's a lot of concerns from hospital leaders that care homes are refusing to take patients unless they've been tested, which isn't in the guidance, and so you can understand why NHS people are getting annoyed about that. But then from a care home perspective, they're saying they haven't got PPE, and so why should they take them? So that needs to be resolved really quickly.
I guess there's been a concern floating about in the conversations I've been having around mental health, because obviously there are massive ethical problems, and with discharging somebody with complex mental health needs, learning disabilities, without the appropriate support in place, and obviously that does take a while to put in place, and like much of the community sector, often that infrastructure isn't there, particularly within mental health services.
And Rebecca, what else is happening in kind of the mental health sector? What's happening in terms of staff in particular?
It's interesting one we did on Sunday, that mental health trusts are sending their junior doctors to support the acute trusts. Now, I think that just shows how unprecedented the times are, because there's no way you would normally get mental health trust leaders saying, yes, here, take my staff. I have enough of them. But it just goes to show how worried people are, I think, about the acute sector and its ability to cope. And it is quite impressive for areas that can do it. But I guess there is also the concern about what's the kickback for mental health services down the line.
And do you have any idea of kind of the particular roles that the staff who would usually be working in mental health, what do you think they're going to be doing? Do you have any clear guidance on that?
I don't yet. It comes back to the point you made about upskilling. So obviously, refreshing their physical healthcare training. I mean, with the junior doctors, that there will be that that training will be still relatively fresh for them. But that will be the focus also within those working within mental health trusts at the moment. So ensuring their physical healthcare skills are up to scratch, and that was in some official guidance that they put out last week.
It'll be interesting to kind of keep tabs on that.
Yeah.
And I think as well, kind of bringing in James now, HSJ kind of ran a really interesting story this week, based on kind of talking to chief executives, surveying them as to kind of on the kind of pressure points at the moment, and we kind of touched on a few of those already. But James, it would be really good if you could kind of go into a little bit more detail on what the survey results showed.
Yeah, sure. So we ran a bit of a kind of snap survey of just chief executives. So we had, in a 36-hour response, we got 34 responses, which is about 15% of the NHS Trust chiefs. So a decent little snapshot of what's going on. We kept the survey deliberately very short, because obviously these people are not time rich at the moment. Everyone is so busy. So the three biggest areas of concern that were raised, the biggest ones were lack of staff testing and staff shortages, and then PPE shortages, unsurprisingly, as well, came into that. One of the interesting lines, just going back to the ICU capacity issue, is that 13 of the 34 said that they expected to run out of ICU capacity sometime next week. So, which is really interesting, because these were trust chief executives. It was all anonymous, but we know which regions they were in, and it was from a broad spread across the country. And Neil Ferguson, the Imperial College professor, who is his modelling is underpinning the government's coronavirus strategy, he was speaking to MPs this morning on the Science Committee, and he was saying that he thought, in terms of ICU national capacity, that that things would be okay, but this indicates that, you know, certainly capacity is going to be breached in quite a lot of places. I mean, it may be that there's some real surge areas, and then there's some areas that aren't as badly hit. But yeah, that was a bit surprising. So yeah, the ICU and in terms of the PPE issues, that certainly came through very strongly. And one chief executive was talking about his clinical staff being in near revolt, was how they put it, over the shortages of PPE.
Did it, James, on the the regional variation, do you remember which regions had the kind of highest concern about their capacity?
I mean, London did come through as a hotspot, but we had the southeast. There was a chief executive there who said modelling will suggest that their capacity is going to run out. So he certainly wasn't confined to the London and Black Country hotspots that we've seen emerge so far.
Yeah. I think one thing to watch, isn't it, is if they're going to start opening big field hospitals in the other cities as well. I think Manchester Evening News have run a story about the GMEX centre up there, where NHS Confed has been held the last few years, and I imagine places like Birmingham and Bristol, Newcastle might be thinking the same.
Yeah, certainly we'd expect all the the big cities to follow suit, really, and hopefully pretty quickly, because yeah, things have turned pretty swiftly in London. I mean, on the Excel Centre, that plan seemed to blindside quite a lot of senior NHS people that I spoke to as well. I mean, the plans rapidly moved from planning into operational phase, and it'll be very interesting to see how they staff it.
Yes, yeah.
And just kind of going back to the point you made about the Excel Centre, I'm just wondering how, you know, I think we're looking at, was the capacity 4,000 additional people?
That's what they've said. It's been reported as 4,000 beds, but
4,000 beds.
I'm not sure that's quite clear. Matt Hancock in the press conference said 4,000 people. So whether that included the staff or not sure. But I think
next week, right?
Yeah, in the press release they said 500 beds from next week.
Yeah, and it was interesting though, because whilst the debate over the last kind of 24 hours between the story coming out and the official announcement, there are a lot of figures being bandied around about having 1,000 ventilators in there. I think the latest figure on that is 500. So they've equipped with 500 beds with ventilators, and oxygen is the latest for the Nightingale Hospital, which is the Excel Centre.
Yeah.
So it'll be, clearly they probably wanted more beds in there, probably wanted more ventilators in there, but obviously they've got to get them. So
yeah,
it's probably a very kind of fluid picture.
Yeah, we saw just in terms of the capacity elsewhere in London at the hospital trust, that David Sloman sent out an email to all the trust execs saying, kind of giving a list of what their expected numbers would be by April 4th, and the numbers were just staggering. For I think for Kingston it was something like a 15-fold increase in beds, the same at the Royal London Hospital, and similar in Croydon. But then when we actually contacted those trusts, they said no, that doesn't sound right. So there might have been a few kind of hopeful numbers put into the table, I think, and perhaps people are now rowing back. It's not quite clear. There's a lot of uncertainty about it, and perhaps they're still just scrambling.
No, I would imagine that to be the case. Another interesting finding in the survey that I just wanted to bring up is, obviously we have heard a lot about leadership since this crisis began. A lot of questions around Boris Johnson, a lot of questions around how quickly the government's moved on a whole range of measures. But in terms of the NHS response, we've a lot of obviously criticism about the PPE issue, and rightly so. When the army has to be called in to bail out the system, then something's gone wrong, albeit some mitigating circumstances. But yeah, so in terms of what the 34 chief executives thought of the leadership and guidance that have come out from NHS England so far, 2/3 of them actually said they were either somewhat satisfied, or very satisfied, and there wasn't that many in the unsatisfied section, which I thought was quite interesting, because, as I say, we've heard quite a lot about how the leadership is in certain areas has been poor, how people have been slow to make judgments, and the NHS is a big clunky machine, and it amuses me sometimes when I hear other countries' news media talking about the NHS like it's one system, and as if you can just change things in a flash, and we know that that's not how it works. But certainly a couple of comments was, one chief said that the centre are doing a very decent job at a very hard time, while others praised the impressive pace and detail of the advice. So it wasn't all bad in that survey. It certainly feels like. Oh yeah, sorry.
I was gonna say, it's interesting. It seems to have knocked the bureaucracy out of the system. the pace at which decisions are being made. Perhaps something that we can hopefully hold on to after the crisis. But
I certainly think if there's one silver lining that could come out of this, it will be that kind of thing. And so the movement, for example, towards more digital consultations in primary care and outpatients, all those sort of things. Some like stuff that would take years normally is happening in days, and there hopefully will be a bit of a silver lining on that kind of side of things.
And I don't know whether it's a step too far, but maybe kind of discharge as well. It seems to be that hospitals have just gone and kind of shifted into a different gear in terms of discharging patients. And I mean, maybe that in some cases that isn't a good thing, but in other cases, everything seems to be mobilizing. I mean, I know you've all had various conversations, but I was speaking to somebody very much outside of London yesterday, telling me that they've got 350 empty beds in their hospital, and they're just waiting. And at the moment things are all right. It just seems that it's just remarkable the speed at which people have prepared for this.
Sorry, Rebecca.
No, I was going to say, James, with the discharge, I mean, I'm looking at your performance watch-wise. Do we have to keep an eye on the number of readmissions we're having?
Quite.
From those beds?
I mean, it's as I spoke to someone who is a real expert in this area, and it was them who was saying that we're going to have to hold our nose about stuff because corners are going to be cut. Now, all these processes, they are clunky and they do take time, but they were put there for a reason. And that reason is largely to look after patients and to make sure that they're not discharged before they're ready to be discharged, and to make sure that when they are discharged, they're being discharged into a setting where they can be properly looked after. I mean, there's got to be a concern that some people will be shunted out before they're ready and then readmitted later on, or some form of harm being done. But that at the moment it feels like things are moving so fast that we're just going to have to accept that some corners are going to be cut, and at a point in the future that slack will have to be picked up.
And I think it will be also maybe quite interesting just to kind of comment on what other things are happening in hospitals. So we know that all electives have been cancelled, but there are still going to be some ongoing emergency kind of, I suppose, operations, I suppose, and also cancer care. But we're seeing a slightly patchy picture of what cancer care is looking like at the moment. We had the story on Barking, Havering and Redbridge earlier this week, and I'm kind of hearing that other trusts are in talks with the private sector to move cancer care out of their hospitals completely. I don't know what conversations you've all had kind of around these kind of, I suppose they were kind of branded kind of a kind of essential services that couldn't be stopped.
It's interesting that so far we're yet to have conversations about on my patch, which is the West Midlands, about cancer services being paused or farmed out to the private sector yet. I say that, a big caveat, yet.
And James, did that come up at all in the survey? Kind of what people are doing around kind of emergency?
Our survey was so focused on the response to coronavirus, we didn't really get that far. But it's certainly an issue that's going to come up. People are going to continue to be very poorly through non-coronavirus issues. But the deal with the private sector, that was just another amazing deal that, again, in peacetime, you would expect to have taken ages to have brokered and got done in a matter of days to kind of hand over around 8,000 beds to NHS control. And I imagine quite a lot of the work we're talking about may well be moved over to the private sector.
Yeah, things are moving so quickly, and there's some huge decisions being made, aren't there? Like we all know that CCGs are kind of in the process of being phased out, I suppose, and then suddenly there was an emergency directive that effectively takes many of their powers away, and so
Yeah.
just one kind of brush and it's happened.
Yeah.
And then the same with the national tariff. It's gone for now anyway. Everyone's on a block contract, and that's been a process happening over many years, and tentative changes each year. Will it ever come back? That will be an interesting question. Will CCGs come back as well?
Yeah, right.
Yes, I was going to ask her, do we know how long any of this is for? Or is it just as long as it needs to be?
I think they have set a date on it, so CCGs till the end of the year, and
well, that date could change very, very easily.
Well, I'm sure. Yeah, I'm sure.
Okay. In that case, I think we have come to the end of our podcast this week. But thank you all for joining me. And just a reminder to listeners that the HSJ Health Check is available each week on the hsj.co.uk website and across all main podcast channels. So do please subscribe and share and get in touch if there's anything that you think we should be covering. We will see you next week with more vital updates on the coronavirus crisis in the NHS. Thank you so much.